in. Hey everybody, it's Barb Scotty with the Near West Side Partners, and we are excited to have another weekly webinar. And this week we are having two guests, Abiola Keller and Dr. Dan Pinto. Before we get started with that, always want to remind folks that here in the Near West Side we are concerned about COVID, and there are many resources available. Milwaukee Active Streets is a great opportunity to be able to get out on the streets and not worry about cars, being out and about and just enjoying a wide walkway. And then tonight's Near West Side, made in the Near West Side, is with 5 o'clock Steakhouse. So they are offering a steak special. And let me tell you, I've done takeout with this the last time, and I never thought a takeout high-end steak would be so good. And you surely can get one steak will probably last about 2 to 3 people. So you don't have to go too crazy, but enjoy that. And then the video itself is a lot of fun, just walking through the restaurant and learning how to, they have a little secret sauce and how to cook a steak properly is a lot of fun. And then finally, we also have our action activities through the Choice Neighborhood Grant. Please do stay tuned on our website to see where we're at. There's going to be a lot of great momentum going forward with some new activities. And as usual with our current social issues going on, remember, we're stronger together. And this is one of the reasons we're here on this weekly webinar, to make sure that we stay connected and have a strong voice. So let's move on. This week's webinar is focused a little bit on mental health, definitely more in the workplace. And of course, COVID has definitely turned our world upside down. We have Dr. Abiola Keller and Dr. Dan Pinto. They are both from Marquette University, and they are working on a grant project called Patient-Centered Outcome Resources for Employees. And are going to share with us some information about that project and how it touches upon mental health. So let's move on. And here's Dr. Keller and Dr. Pinto. They are on our screen. So Dr. Keller, would you please introduce yourself and tell us about your research and your past?
Sure. Thanks for that introduction, Barb. As Barb mentioned, my name is Abiola Keller. I'm an assistant professor in the College of Nursing at Marquette University. My area of interest and expertise is really focused around promoting the health and well-being of African American women, particularly focused around issues pertinent to women who are caring for older adults. And as Barb mentioned, I'm one of the project co-leads on the patient-centered outcomes research for employees of the Near West Side project.
Thank you. Dan, how about yourself?
Yeah, hi. Thanks for having us on. Really appreciate it. My name is Dan Pinto. I'm an assistant professor in the Department of Physical Therapy at Marquette University. And my research is, well, I'm the director of the Beta Lab, the Behavior Engagement and Health Technology Assessment Lab. So really what we do is cover a lot of health services research, look at how health processes work. I'm a licensed physical therapist. A lot of times I think about how do we better help people self-manage as a really key ingredient to what we do in the clinical environment. So a lot of my research is focused on that.
Great. Well, thank you. I'm going to pull us back a little bit from, so we can, as we talk, you guys are a little more obvious and come to the screen. So we will, there we go, grid view, and this is, can you see everyone a little bit better? I think I'll just move to that slide next, so we're there. Let's ask a question. So COVID has been a disruptor in our lives in a very, very big way, and it's created a new normal. It has also caused us to work from home, maybe. Some of us have never left work. Our jobs are different. Our businesses are run differently, and it's created quite a bit of havoc for all of us. And how have you been able to identify how COVID is really affecting employees in the Near West Side that are impacted by this total change of what's happening in the world today? Dan?
Yeah, well, so I think one of the major things that's happened is it's just COVID has completely disrupted our patterns, right? Disrupted our habits, and that provides for us an opportunity, and it also can just be really problematic. So what we're doing in terms of identifying what's happening is really utilizing the infrastructure that we've just spent the last 2 years building, which is the panel and our relationships. And so in the workplace, we've connected with leaders in health and wellness, and we've asked them about how their people are doing, what things have changed. One of the things that happened prior to COVID is our panel identified mental health and well-being as a key area of importance. And as we've been able to contact them through, a format like this, our health and wellness leaders and the employees who are on the panel, they've all just said that the need for mental health and well-being has just skyrocketed.
And Dr. Keller, the health and safety of everyone is a big concern, and what's been brought out from the research with the patient-centered outcome program?
Yeah, so as Dan alluded to, so our project has really been focused on building an infrastructure for looking at health concerns, right now focused on employees in the Near West Side. And so to address that, what we've done is really created this unique partnership between the employers in the Near West Side and their health and wellness representatives from each of those employers, but then also inviting the employees that have multiple chronic conditions to join us at the table, as well as researchers and clinicians. So everyone bringing their unique perspectives and their unique strengths to really address this issue of health and wellness and well-being from different perspectives has led to, I think really invigorating conversations and thinking about, what are people doing, and by people I mean organizations. What are organizations currently doing to protect and promote the health of their employees and thinking about health holistically, so both mental health and physical health. What's working, what's not, and why might some things be working and some things not be working. And this, partnership has really been a great opportunity to share best practices and to leverage each other's strengths and ideas to really focus around one goal of improving health for employees in the Near West Side.
Wow, that's amazing. Dr. Pinto, you're the one that I think originally dreamed up this project, which is called Patient-Centered Outcome Research for Employees. So we acronym it PCOR. Tell us your story on how the project came to be.
Well, I joined Marquette University 3 years ago and had done training prior to that at Northwestern University in patient engagement and activation. And as part of orientation at Marquette, we had the option to take a tour through the Near West Side. And that tour was led by the Near West Side Partners Director, Keith Stanley. And as I was learning about the Near West Side and the achievements of the Near West Side Partners, I was just thinking, this is, the Near West Side Partners has done incredible work. And I just started to ask the question, I wonder if there's been focused attention on health and well-being within the partnership. And really, that's where the conversation got started. I contacted Keith, and we started to have some meetings, and we built our team and started to ask questions around the neighborhood and among the anchor partner members, the corporate members. And really the interest increased that we set up the infrastructure to do a project and to do multiple projects. And really that's what Abiola was speaking to. What PCOR is, the Patient-Centered Outcomes Research for Employees, is building the infrastructure to really do a lot of great work. And we hope to take that work not only from our corporate sites, but to also do the work in the neighborhood as well, improving health and well-being.
Amazing, which I don't think I gave full disclosure to as we started this webinar today, is I am actually on staff with Abiola and Dan as part of, I'm the research officer. So I guess I do have, what do we call those? A conflict of interest.
Yes.
And that I do understand pretty much what's going on with this organization, what we're doing here and why we're trying to do it, and appreciate that we're able to use this platform to help people understand and then bring things like the topic of mental health to a forefront, because it's important for all of us. And with the current crisis, two of them, that we need to make sure that we're all taking care of ourselves and that people have a safe place to be. So thank you for that. Dr. Keller, can you explain to us a little bit about what opportunities that PCOR can provide to help elevate the concerns of health and wellness in our community and during COVID that might that touch upon employees in the community?
Sure. So as you can expect, when you bring together multiple stakeholders and representatives from different organizations, one of the first things that we needed to do as this new group was identify what our goals and interests were, and what our priorities were. And this occurred even before all of the activities related to COVID and the elevation of this, the social disparities that we're seeing in our communities. But even before all of that, this idea of mental health and wellness for employees really resonated with the members of our panel as an area for as an opportunity area. Everyone was already doing something in that space, yet we recognized that there was an opportunity and a need to do more. And so having conversations about, what else could be done has been really beneficial. A lot of our organizations have existing EAP programs, so employee assistance programs that employees can contact, if they feel that they need more support or services. But, really seeing that, either those were not being utilized as much as we would expect, or we were seeing people who needed more support than that was able to provide. And so, that being before, this disruptions that we've seen. And as we've been working in this space through all of these recent crises, we recognize that the idea of supporting employee mental health and wellness has to be a top priority for our group and for employers as we look at, how people will, first of all, whether or not people will return back to work in the way that they were accustomed to before COVID, or what transitions in work will take place, or how people have just managed to juggle, the losses and the traumas that have occurred in the last couple of months. And so we have an opportunity to be collective and innovative about how we address these. And I think it's one of the exciting things that we're doing now. As we talked about, PCOR was really about building this infrastructure to do projects. And so we're really excited about this project that we're launching. And I'm gonna let Dan talk a little bit about that project now.
Yeah, absolutely. Thanks, Abiola. And one brief thing is, I think and I should have mentioned this earlier, just that we're funded on this contract by the Patient-Centered Outcomes Research Institute. And one of the things that they do is they give us a lot of time to work together and kind of better understand how we speak with each other and how we can all get on the same page. And part of getting on the same page with mental health and well-being is recognizing that, a lot of the recommendations that go out behind improving your health and mental health and well-being and stress management are things like eating well, sleeping well, getting regular physical activity, and not eating, avoiding excess alcohol and caffeine and things like that. And there are things that people often have heard before, but have not perhaps made a personalized plan for themselves. So what our focus has been is to leverage some of the work that has been ongoing in my lab in partnership with computer science. And we built a electronic infrastructure for this tool called brief action planning. And essentially what we do is we work together with an individual to make an action plan about their health. And it really is completely patient-centered. It is their action plan, they drive it, we support it. Where there's a lack of information on what a plan might look like, we provide ideas on how that plan might look, ideas on potential plans, but really the power in brief action planning is that every individual is the expert in their personal experience. And what we do is we respect that and just support the decisions around that. And that's really the primary focus around how we want to move forward in the workplace and in the future, hopefully in the neighborhoods as well, around making a plan about their health.
Thank you. So let's wrap it up. And I guess my question to both you is, what makes you most excited about the PCOR project and what it can do for us in the future? Dr. Keller?
Sure. I think that for me, it's this, and I'm stealing these words from Keith's family, so thank you, Keith. But it's the idea of the power of the partnership. And I think this is a real life example of what can happen when you bring people together that normally would not be in the same room or at the same table. So, I think it's common for, the health and wellness representatives from our organizations, to work together. They speak the same language, or they work in the same space, whether it be in different industries. But then to put that and bring employees who work at these organizations to the table, and then you add researchers who are actively engaged in work around this space and in engagement work, and then you add clinicians, these are people that wouldn't, in most circumstances, interact or work towards a common goal. And so I think for me, what's been exciting is to see this group really come together and to, be able to move forward with a project that is very, engaged about addressing a real need in our community.
Thank you. Dr. Pinto?
Absolutely. What I'm most excited about is really the potential. I mean, this is the workplace and even our neighborhoods we're really working at a large population health level. And we have the potential to help improve health across multiple different types of populations and communities. And that's what gets me most excited about this project, about the Near West Side partners. We're also kind of closing the communication loop, right? So a lot of times we are able to interact together and learn from each other and adapt and hopefully produce better and better interventions and ways to be healthy.
Thanks. I am going to pull us back just a little, if I can get this. I don't want to leave my technology still. Okay, we're going to go speaker view. Oh, it's Dan. Yeah, go ahead.
I would like to say this. Because our title was mental health, and then that being the focus of where we're moving forward with our project, I was thinking that people may be attending this and having direct mental health needs. So we're posting in the chat right now, Milwaukee County Health and Human Services 24-hour crisis hotline. So if you are going through a crisis and experiencing desires for self-harm, please call that crisis hotline. There's also, we know that unfortunately during COVID-19, there's also been an increased rate of domestic or intimate partner violence. And so we are also putting resources there for the Milwaukee County area where you can identify some of those hotlines that are separate than the 24-hour crisis hotline.
Thank you. And this was also a suggestion by Dr. Pinto that we were sure to make some of this information available because it has been a trying time. And regardless, if you need help, asking for help can be hard. And this is a great way to at least get started with that action. Brittany, are there any other questions in our chat room today?
So in our chat room so far, we have one question, and it is, how has COVID affected PCOR? Have the goals changed? How about outreach?
The primary effect of COVID on PCOR at first was just, like most workplaces, transitioning and affecting how we interact. I would like to say what it did is elevated the importance of mental health and well-being, though we identified that earlier. The other thing that it has done is it's given us an appreciation for the changing landscape of health and wellness. And what I mean by that is, workplaces may not be coming back like fully into the campus setting as they were when we started. So when we started this, a lot of it was inventory taking, what's happening within health and wellness in these different campuses, and how can we work with that? Well, if half of the employee workforce is no longer directly accessing these physical resources, how can we provide opportunities for them to do that if they are staying at home? I would say those are two primary things.
Any additions to that, Dr. Keller?
No, I think Dan did a great job of answering that. I think the other thing too, like many organizations, we are more intentional about just checking in on people, and just seeing how people are doing. This has been a very trying couple of months for many people in all sectors and communities. So I think really, as Dan mentioned, I think this is, kind of, it's reinvigorated a lot of us into the purpose of what we're doing and the opportunities that we have to make an impact on health and well-being for employees and also residents of the community.
Yeah, agreed. Thank you. Well, thank you. Let me do one more thing.
One more question, Barb.
Oh, okay.
So our next question is, could you talk some about interconnectedness? Can you address health in our communities and interconnectedness?
So I'm going to take a stab at this, and if I'm not going the right direction, please redirect me. But I think that, oftentimes when we think about health, we tend to think of it as a standalone product. But really health is produced by multiple things. And so when we think about, to improve health, we have to pay attention to things like the built environment, people's ability to be economically stable. We have to think about things like social connections and social support. And, yes, we have to think about access to health care, but we also have to think about access, the ability to engage in physical activity. So whether it's the physical space to do that or the time and opportunity to do that. We have to think about things like, access to fresh foods. So I think interconnectedness, for me, when I think about health, is really thinking about how those social things work together to produce health. And you can't improve health if you only focus on one of those things. You have to lift all of it in order to, I think, effectively and improve health in a way that is impactful and sustainable.
Absolutely, 100% agree with that.
Okay, cool. Okay, now are we done, Brittany?
No, we have one more question.
This is great.
Okay, yeah. This is awesome. Love it. Thank you, people.
Yeah. So our next question is, could you both talk a little bit about the future of PCOR and health in the Near West Side?
Yeah, the future of PCOR is that we will continue to meet as a panel. We will continue to talk about priority needs within the workplaces of the Near West Side Partnership. And we will always have employees who are managing conditions and are sort of the end users of the health and wellness at the table and helping to inform and guide and partner with decision-making around health and wellness. What the future of the Near West Side Partners and health is looking bright, I think. We are transitioning to increase our focus on health in the Near West Side as part of the Near West Side Partners. And so I think there is huge potential, huge capacity to do health work, right? If you're thinking about it from, you know, a research lens. And we've already started some of that with, so ways in which you can participate as the resident surveys. When we have questions related to health, we want to know, what do you want focus on, right? This is, you know, our original funding was patient-centered, right? So we want to be moving in alignment with the health needs and the desires of the community. And part of that is the participation. So where we are able to have conversations, which we will increase in the neighborhoods in the future, we want to hear from you.
I think also, you know, kind of going back to the last question about interconnectedness, one of the, I think, very wonderful, but, you know, like unintended that we didn't really think about this when we started PCOR, is how this idea of having a group that's focused on health has kind of spilled over to all of the other activities within the Near West Side. And so when we think about, you know, all of the activities that are going on, it's, you know, we can now start to have conversations about, well, what are the potential health implications of this program, or doing this activity, or, you know, doing, you know, whatever it is, as we think about that health is produced by multiple things, we can start to kind of take a health lens to all of the activities that are happening within the community.
I just wanted to mention that, Abiola, you answered that connectedness question perfectly. Was the response?
Thank you.
Love it. Okay, I'm going to go back to our slides. I think share. Where's my share screen? Oh, people, how do I do this? Oh, there we go. Okay, so if you do have specific questions for either Dr. Keller or Dr. Pinto, there is their contact information. Certainly, if you're not able to get it down quickly, always contact us and let us know of any questions. I would say also, is Dr. Pinto mentioned, you know, being involved is one of the best ways you can raise your voice. So whether it's a survey, just this example, everyone that logged on today, thank you. That is how you stay informed. That's how you can elevate your voice and expand your interests. So that's extremely important. So when you see those opportunities, trying to do what you can, and that other example flows into with our social unrest and racial injustices, you find your own niche on the best way to help the cause. So I just empower everybody to do what they can within their abilities, their comfort levels, and to just be as active as you're able. And again, thank you for joining our event today. I do appreciate it. And then next slide. Okay, where we there we're that. So we have our questions answered. Next week, I believe we're on a we've had a little scheduling glitch. Go figure. And so stay in tune for who we will be bringing in next week. But do plan on us being here Wednesdays at noon. And if you have ideas, suggestions, feedback, please always let us know. And again, thanks to everyone for taking time and being part of our community. Have a good day.
Thank you.
Thank you.
Thanks.
Bye.